So I've started recording. Hello, this is Clara Saint with Gilda's Club Kansas City, and I'm turning it over to Miss Savannah Geske for our tips for sleep concerns today.
Yeah, so I was gonna say I saw some familiar faces on the view as well. Savannah Geske, I'm a licensed psychologist, and I work within the St. Luke's Cancer Institute and the Kuhn Center for Advanced Breast Cancer. And obviously, we're going to be talking about tips for sleep concerns today. This is something that I have already been doing with people, but has really had an uptick, definitely since the COVID-19 pandemic has set in. This is actually the second presentation I'm doing over this course of 2 weeks on sleep, and then I have another one on Friday that I'm actually doing for physicians. And so this is actually definitely something that we have seen on the rise, and I think is important to talk about. So hopefully we'll get you some tips for getting some better sleep. My clicker seems to not be working. There we go. Okay. So I always think it's good to kind of go into stats first. And so obviously sleep concerns are very prevalent throughout a cancer diagnosis. Specifically, we see that about 50% of most individuals with cancer will experience sleep disturbances, and up to 80% of individuals can experience sleep disturbances when we start looking at those who have metastatic or advanced cancers. This is due to a variety of different reasons. So 70% of the reason that people report sleep disturbances is actually due to emotional distress. And so you might recognize this as kind of those racing thoughts, right? We lie down and we're very tired, we're ready for some sleep, and as soon as our head hits the pillow, our mind just starts racing, starts worrying about things, or just cycling over things that are not even necessarily that important. I gotta go to the store tomorrow, what am I gonna get? And so we see that the majority of our reasons that we can't sleep is due to kind of our mind not being able to get shut off. 25% of people do report sleep difficulties due to side effects, and then 5% due to pain. Interestingly, we see that family caregivers can sometimes experience sleep disturbances at an even higher rate than those who are actually going through cancer treatment. So on average, we see about 72% of family caregivers experience sleep disturbances. We haven't done a lot of research on other caregivers, friends, extended family, that sort of thing, but from talking with individuals and people's support system, those rates also seem to be pretty significantly high. And so these are techniques that you can use, or you can even share with your family for them to use as well. So why does it matter? We talk a lot about sleep and insomnia. Why are we so concerned with this? Well, there's several things that we're really concerned about, right? So data actually suggests that if we are not getting enough sleep, we can actually be predisposed to suicidal thought or completing suicides. So that's obviously something that we don't want to have happen. Those who have disturbed sleep or have insomnia also are more prone to develop post-traumatic stress disorder. They're more likely to have depression and anxiety disorders. Substance use can also increase. I see this a lot actually where, we have a glass of wine one night and that actually seems to help. That seemed to help put us to sleep. So we're gonna have a glass of wine the next night and the next night. Well, unfortunately, we get habituated to alcohol and now we need even more of it to get that same effect. And pretty soon I see people who are drinking 3, 4, 5 glasses of wine every night, trying to help get themselves to sleep because it worked one time. So we can definitely see an increase in substance use. Also, we can see a decrease in immune functioning. One of the things that our body does when we're asleep is actually it repairs cells and tissue. And so if we're not getting asleep, this is not happening. And so we can actually see that decreased immune function can start to happen. And there's also a lot of other research that I didn't include here on things like cytokines and inflammation. And really we see that it starts to interfere with the immune functioning, it increases inflammation, and then really just puts us at a predisposition with illness. And so if we're talking about recurrence, a decreased immune functioning is definitely something that we're going to be concerned about because we want that immune functioning as strong as possible. So this is actually the Insomnia Severity Index. And so I just want everybody to just kind of answer along as I read these and kind of record your answers, because on the next sheet, I'm going to actually show you where you would fall if we were looking at, oh, I'm gonna get this out of my way. It kind of came into my front waiting room. Okay, and so we're actually gonna go through this and so we can actually see where you would fall. So the first question is, rate the current severity of your insomnia problems with difficulty falling asleep. 0 being none, up to 4 being very severe. Next question would be difficulty staying asleep. Again, 0 being none, 4 very severe. Problems waking up too early, none, mild, moderate, severe, or very severe. Next question is, how satisfied or dissatisfied are you with your current sleep pattern? And you can rate that from 0 being very satisfied, which I imagine if you're here listening to me, that's probably not an answer that you've given, or 4 being very dissatisfied. The third question is, to what extent do you consider your sleep to interfere with your daily functioning? And you can rate that from 0 being none at all the way up to 4 being very much. Question 4 is, how noticeable to others do you think your sleep problem is in terms of impairing the quality of your life? Again, 0 being none at all, up to 4 being very much. And then the last question being, how worried or distressed are you about your current sleep problem? And you can answer that from 0 being none at all, 1 being a little, 2 being somewhat, 3 being much, and 4 being very much. I'll give everybody a couple seconds to kind of tally their results to that while I take a sip of water here. So this next slide actually shows the threshold scores. And so if you scored between 0 and insomnia, you know, we still might be experiencing sleep disturbances, but thankfully you're not actually meeting criteria for any insomnia. If you scored between 8 and 14, this is what we call subthreshold, or another way to think about it is kind of mild symptoms of insomnia. 15 to 21 is moderate, and then 22 to 28 is severe. And so really any score 8 or above, we would say you would be appropriate for doing some type of intervention to improve your sleep. And really it doesn't hurt either if we're scoring between 0 to 7 to also do some interventions to improve our sleep. When we talk about improving sleep, these are actually some snippets from the American College of Physicians, the American Academy of Sleep Medicine, and then the NCCN, which is the National Comprehensive Cancer Network. And so as you can see from all these snippets, the recommendation number 1 by the American College of Physicians recommends that any adults who are experiencing insomnia actually complete cognitive behavioral therapy for insomnia as the first line of treatment. It actually, CBT, some of the techniques that we're going to talk about today, outperform medication. The American Sleep Academy also recommends that the first line of treatment be psychological and behavioral interventions, including cognitive behavioral therapy. And you can also see on the right side of the screen, the NCCN also recommends as the first line of treatment for insomnia to be CBTI. I have a lot of people who I don't see until they've been taking medication for a long time. And the research doesn't really support that medication should be our first line of treatment. And so a lot of the techniques I'm going to talk about today are included within the CBTI protocol. So they're things that you can start doing on your own before you see any mental health provider. So when we talk about what can improve sleep, the number 1 thing that's going to be most important for us when we talk about ways to improve sleep is actually going to be maintaining awake time. And the reason that this is important is it helps to increase our sleep drive. And so I'm going to be talking about sleep drive throughout this presentation. And it's really easy to think about sleep drive as being your appetite. So if I tell you that at 7 o'clock tonight, I'm going to make you a big meal, and I'm going to have it ready promptly at 7, what are some things that we would do to make sure that we were hungry? Normally I'm talking to people, so I get some of your responses, so I'll just throw out what I normally hear. So if I told you that I need you hungry, I would hear things like, well, I would probably skip lunch. I would make sure that I wouldn't have any snacks. You know, I really probably wouldn't eat anything, you know, all day long maybe. And in that way, we're building up a nice, strong appetite. So when I put this big plate of food in front of you at 7 o'clock, you are going to be likely to start eating it right at 7. And you're also going to be more likely to finish this meal. Sleep drive is the same thing. If we can build up your sleep drive, when it is bedtime, we are going to increase the likelihood that you will fall asleep and that you will stay asleep. Another way of thinking about sleep drive is being like a balloon, right? If we want a balloon to be able to let go and kind of zigzag all over the room, it needs to be very, very full. We need a nice, big, taut balloon. So when we let it go, it can kind of take that path. So we think about it as a balloon that we're filling up nice and big, or appetite where we're really improving it. And so wake time is important because if you don't get a good sleep, let's say, last night you normally get up at 6, but you didn't go to sleep until 2. Well, so your alarm goes off at 6 and you said, I just didn't get enough sleep. I'm going to sleep in, and then maybe I don't get out of bed until 8 or 9 in the morning. Well, essentially what we've done here is we have kind of created a jet lag, right? Since you have spent an extra several hours sleeping, we now are not going to be tired around 10 when you normally go to bed, because we now have 3 less hours that you have been up and moving around. So when we do things like extend our wake time by a couple hours and sleep in, or if we have naps, this is the same as you being like, on the day that I'm going to make you the dinner at 7 o'clock, you had breakfast at 11 and then you had lunch at 3. Well, of course, you're not going to be hungry when 7 o'clock rolls around. All your meals have been pushed back. You might still eat a little bit, but you're not going to eat very much of my food. So this is when we see people might fall asleep, but then they don't stay asleep. They get about 3 or 4 hours of sleep and then they're right back up. And so pushing our wake time back or napping are really things that can start to interfere with our sleep drive. Ways that we can improve our sleep drive is actually avoiding caffeine. There's a lot of studies that caffeine stays in our system a lot longer than we think it does. We know it at least stays in our system for 4.5 hours. Most studies see that it stays in our system for 6 hours, and some have even suggested 8 hours for those who are more sensitive to caffeine. So I have a lot of people who, have a soda with dinner and then they don't think anything about it. Well, unless your bedtime is 8 hours after dinner, having a caffeine beverage would probably not be a good idea. We also see that increasing your natural light exposure can also improve your sleep drive. It's also very good for us because it starts increasing vitamin D, which is a supplement that our body really enjoys using. Avoiding naps and sticking to your wake time also creates that nice, big, strong appetite. And then also exercise. So if I want you sleepy, a good way to get you sleepy is to actually expend energy so we have kind of tired you out. And so these can be things like yoga, walking, light weightlifting. This does not have to be very extreme cardio. Any exercise that we can be getting you is going to be increasing your sleep drive, right? That would also increase your appetite. If I told you that your dinner was going to be ready at 7 and then you went for an hour walk before dinner, perfect. You've now expended a lot of energy and you're going to be much more likely to eat my meal and eat the whole thing. And so sleep drive is definitely something that we need to be mindful of. Within the same vein of sleep drive, we now have sleep restriction as well. And so we see a lot when we talk about insomnia, we talk about predisposing factors, so we actually maybe have our genes, we're more likely to get insomnia because of our family. We have perpetuating stressors like cancer, COVID-19 that now cause us stress and we develop sleep disturbances or insomnia. And then we have what's called perpetuating factors. And these are things that we do that we think are going to be helpful, but actually can make sleep worse. So one of the things that I see as a big no-no and a lot of people do is going to bed before they're sleepy. So I have somebody who wants to be going to bed at 10 and getting up at 6, but when they go to bed at 10, it's taking them 2 hours before they fall asleep. So they go, well, I know what the answer to that is. I'm going to go to bed 2 hours earlier. I'll get in bed at 8, so then when 10 o'clock rolls around, I'll be much more likely to fall asleep because I've been laid there for 2 hours. Well, not necessarily, right? What we're doing now is we're just resting, and so we are actually ruining sleep drive by just laying there and kind of passively waiting for sleep to come. We're now resting, we're not expending energy, we're not increasing your appetite for sleep. So then what happens is I used to lay in bed for 2 hours, well now I'm laying in bed for 3 or 4 hours, and now I'm actually getting agitated, right? By the fact that I'm not asleep, my mind is racing. The bed now becomes not relaxing and it becomes a place where we just are stressed. And so we're going to talk about that as well. So when we look at sleep restriction, I do not want you to go to bed until you are sleepy. So if you would like to go to bed at 10, but you're not tired at 10, I don't want you getting into bed. I would rather that you stay up until 11 or midnight when you're sleepy and then get in the bed. We're going to see that when you go to bed when you're sleepy, you're going to be more likely to fall asleep and stay asleep. That being said, if you're unable to sleep, you need to get out of the bed. I don't want you watching the clock. A lot of people will watch the clock and say, well, it's been 15 minutes. Do I get out of the bed now? We don't need to be paying attention to time. I want you to get out of the bed when you feel like you're trying. You now feel like you're counting sheep. We're trying to distract ourselves. Well, now you're trying to sleep. Sleep obviously isn't ready to come. So we need to get out of the bed, really preferably leave the bedroom altogether and engage in a boring or relaxing activity. And then go to bed when you're actually sleepy. So let's say you don't go to bed until midnight, you lay down, we don't fall asleep, we get up and do something else for an hour and a half, 1:30 rolls around, we finally lay down and we fall asleep. And then 6 o'clock rolls around and that's what's time you're supposed to get up. Here's where a lot of people get off track is, well, I've been sleeping for 4.5 hours, that's not enough sleep, I'm going to extend my wake time. Again, that's going to undo all of the good that you did. What we want you to do is no matter how much sleep you get up at your set wake time. It's going to be kind of a long day, right? Because you only would have gotten 4.5 hours of sleep, but this is kind of like we starved you. And so now when that 7 o'clock meal arrives, you are going to be much more likely to be hungry and eat all the food that I gave you. The day might be long, but when 10 o'clock rolls around the next night, we have very much increased the likelihood that you are going to fall asleep and you are going to stay asleep. And really, at the end of the day, we're not searching for we're searching for quality. We really don't care how much sleep you get. I always ask people, would you rather get 10 hours of sleep, but every hour on the hour you're awake for 10 to 15 minutes? Or would you rather get a 5-hour chunk of sleep? No one who I have asked that question to yet has said, I would rather get 10 hours waking up every hour for 10 to 15 minutes. Most of us agree if we could get a smaller chunk of good quality sleep, we would much rather take that. And so by doing these sleep drive and sleep restriction techniques, we're more likely to get these chunks. Maybe we're not getting 6 to 8 or 7 to 9 hours, but we're getting good quality chunks. Other things that are good for helping the body get ready for sleep is actually creating a buffer zone or creating a nest. So I have a lot of people, again, who make the mistake of doing too many things in bed. Really, the bed should only be used for sleeping and maybe sex. There's actually some researchers who argue we should even be having sex in our bed because, again, that's increasing arousal with the bed. This now is not a peaceful, relaxing place. This is a place where we are doing other things. And so what we really want to do is create a nest that's somewhere else outside of the bedroom where we can now be doing a lot of these wind down activities like watching TV, reading, doing puzzles. It's going to be nice and soothing. It's going to be kind of slowly getting us ready for bed. And then it's also going to be breaking that connection between the bed is a place where we can be awake, right? If we're only in the bed when we're sleeping, when we lay down, our brain is much more likely to go, aha, I'm here because it's time for bed. I'm not here because I'm doing something else. Other things that are actually good for your bedtime routine is to start activating your 5 senses about 1 hour before bed. This is very good if you have raised children. And so anybody who's had kids tells me about very extensive bedtime routines, right? Where we read them books and we did the bath and we got them in their nice fluffy pajamas. This is why about an hour or half hour before kids' bedtimes, they start rubbing their eyes and they get cranky because we give them so many cues that sleep is coming. Their body already starts to produce melatonin and get ready for bed even before it's time for sleep. And so we want to give your brain a lot of cues also that sleep is coming. And so if we were to activate the sound, we would really be thinking about music, podcasts, audiobooks, kind of, again, giving our brain a cue. All right, here it's coming. You know, sleep is coming. I always listen to this podcast before bed. I always listen to these books before bed. Sight. So, you know, you might hear a lot about TV, iPads, iPhones, and things like that. The thing that we're most concerned about when we talk about those devices is actually the light that it emits. And so when you go into a hospital or business, all of the lights that they have are very bright. They're very bright fluorescent lights. And they're designed that way because we want to keep people awake, right? We don't want people who are in the hospital sleeping. And so those lights are very activating to us. It's much more soothing to our eyes to have those lights that are kind of like that yellowy orangey color. We don't see those as much anymore because now we have these bright LED lights. But those dim, orangey, yellowy, those are a lot better and they're less activating to our brain. And so I would argue that we really kind of want to start turning off electronics, turning on lamps, dimming the lights, and kind of just getting that kind of feeling of darkness. Again, not so dark where you're tripping or we're predisposed to accidents, but letting our brain know, all right, the light's getting down, it's getting time for sleep. Taste is also another sense that we can activate. We really don't want to be, again, eating a lot of food before bedtime because then our body ends up digesting and not sleeping. But small snacks, this is kind of where that, old wives, statement of warm milk comes into play. It's not that warm milk actually makes you sleepy. It's just such a distinct taste that it can give the brain a cue, oh, it's time for bed. And so you can be doing things like sleepy time teas. It probably won't make you sleepy, but our brain can now start using it as a cue as, oh, before bed, I always get chamomile tea, right? So I'm having chamomile tea, it must be time for bed. Touch is obviously things like our comfy PJs. I have a lot of people who, as soon as they get home from work, jump right into their pajamas. Well, it would actually be better if you saved that until about an hour before bed, because then it can stay a cue for sleep, right? If we're not putting them on until shortly before bed, it's giving our brain a strong cue that sleep is coming. This is where things like taking a bath, putting on lotion, all of these things can start to be signals to the touch receptors that it's time for bed. And then obviously smells, lotion, candles, diffusers. And so maybe turning on a lavender scented diffuser about an hour before bed, we're giving the brain lots of cues, get ready because sleep is coming. Another thing that I like to talk about when we think about sleep is also the way that we think about sleep. And so we know for a fact that our thoughts influence our feelings and our behaviors. And so here, this is an example of, again, where I would normally have participation, but I'll walk you through what I normally hear people say. So let's say that you're at work. Again, very few of us are actually at work during this time. But if you were at work, a friend would walk by and they kind of glance your way, you say hello, give them a little wave. They make eye contact with you, but then they don't wave, they turn away and they just keep walking. So they don't answer. Well, our brain automatically, when something like that happens, our brain starts to think about why did they do this? And so we can have a variety of thoughts about why did they do this. So if my thought was, she's mad at me, right? I must have said something, I must have done something to make her ignore me, she's actively doing this. Well, that's gonna make me feel anxious, that's gonna make me feel sad, and that's gonna influence me to maybe text her, call her, follow her, see what's happening. So what I thought about the situation influenced how I felt, and then the behavior that I engaged in afterwards. Opposite would be true if she walked by, waved, didn't wave at me when I waved at her. I could say, well, she is kind of a ditz, right? She probably didn't even see me. She's already kind of flighty like that anyway. That would probably make me feel a little bit irritated, but wouldn't influence my behavior to really do anything. I might text her and say, hey, I waved at you and you didn't wave back, but it wouldn't have that same intensity. And so we really want to also be mindful of what we're thinking as we're falling asleep. So this is actually a CBT thought record, and this walks us through kind of this model of how our thoughts influence our feelings and our behavior. And so I really like this, especially when we talk about sleep, because I have some people who will have the thought of, if I don't get at least 5 hours of sleep, I am not going to be able to function tomorrow. If I have that thought and I already only have 6 hours left in bed, that is going to elicit anxiety, right? If my brain is saying, I need 5 hours. If I don't get it, I'm going to be a wreck. Obviously, my anxiety is going to go up. My mind is going to start thinking more about that. I'm going to start to feel anxious. And what is that going to do to my behavior, right? Is that going to make me feel relaxed and soothed? Absolutely not. That's going to make my heart rate go up. My blood pressure is going to go up. I'm going to start getting restless and moving around a lot more. And now it's actually even less likely that I'm going to be falling asleep. And so what we really want to do is examine what evidence supports this thought and what evidence doesn't support this thought. So if we had the thought, if I don't get at least 5 hours, I'm going to be useless tomorrow, we would say, well, what evidence is there of that? Has there been a time where I've gotten 5 hours of sleep and been functional? Most people would answer yes. We would argue that I didn't feel so great that day, but I functioned, right? I got up, I took care of the kids, I got to work. I didn't feel great, but I did it. I always like the thought, I've done a lot more with less. I've done a lot more with less sleep, and I've done a lot less with more sleep, right? There's always days where it's like, we've slept great, we maybe got a full 8 hours, and then we spent the day doing nothing, kind of putzing around the house, laying on the couch. And so I always like that thought, I've done a lot more with less, and I've done a lot less with more. And so we really want to challenge that thought and say, what evidence supports this thought and what evidence doesn't support that thought? And then we want to, after we've challenged it, come up with an alternative thought. And so that alternative thought would be, I functioned with less than 5 hours before. It wasn't pleasant, but it was doable. If I don't get to sleep, it's not going to be the end of the world. So in that way, we have actually decreased anxiety and also decreased a lot of those negative behaviors that would have fallen afterwards, with things like getting anxious, increased heart rate, increased blood pressure. And so this is actually these CBT thought records. You can actually easily find these online. I can even share these with Clara if we need to be distributing them, but I really like these. It also gives you a lot of prompting questions at the bottom too if you get stuck. And so I really like this as a way to kind of reduce the anxiety provoking thoughts that we get. Another technique that I really like that kind of falls within the cognitive therapy realm is actually journaling or worry time. When I tell people that I want them to schedule worry time, I kind of get a lot of confused looks, right? Because I have a lot of people who are like, I'm supposed to be sleeping, right? I don't want to feel anxious. How is actually sitting down and talking about or writing about my anxiety going to make that feel better? Well, the reason it does is because we think faster than we talk, and we talk faster than we write. And so when we actually write those thoughts down and kind of spell them out, it starts pumping the brakes so our brain just doesn't keep cycling over these same thoughts over and over again. This really starts to challenge that fight or flight response. Our brain likes to think that if something bad is happening or there's some danger going on, that if we just come up with a variety of solutions, we can somehow be prepared and then we can get through whatever that situation is. Well, that sounds like a very good idea in theory, but in reality, when we do this in our brain normally just cycles over and over and over again about worst case scenarios. And so not only can we pump the brakes, we can also start to identify solutions, right? So I always like grabbing a sheet of paper and then just drawing a line down the middle and then writing your concern and then potential solutions. So this person, for whatever reason, as they were trying to sleep, their brain was just like, well, I just need to get my oil changed. If I don't get my oil changed, I don't know what I'm going to do. Again, this is not important, but the brain just won't let it go. Here's where I would want you to get up out of bed. I don't want any of this taking place in bed, any of those challenging thoughts or journaling. We need to be doing those in a different location. But I would want you to write down the concern and then write down the solutions. I can look at the calendar to see when I have time this week. I can find places open on the weekend if I don't have any time open during the week. I can also see if my spouse could do it. So we're generating solutions. So this column method will actually be helpful when there's real solutions that can be found. For those ones where we're just worried, like right now with COVID-19, we have a lot of worries about, what's going to happen with the economy. Am I going to have a job when this is all over? We might necessarily not be able to do solutions at this point. So then that's when I would just want you to do the journaling. So then we can at least get those thoughts out of our own brain, and then you do not have to carry those with you anymore. So we also know that relaxation training can be very good as well. So again, our brain has started to become hyper aroused, is what we call it, to the bed. The bed is no longer associated with kind of a peaceful, calm place. We spend time worrying there. We spend time tossing and turning there. And so sometimes it can be helpful to actually do relaxation training preferably in our nest. Again, I don't want you doing this in bed either. I only want you to be sleeping in the bed. And so something else that we can be doing in the nest is actually progressive muscle relaxation. And so this actually assists the body with realizing the difference between tense and feeling relaxed by actually tightening and releasing your muscles. And we'll actually walk through, for time's sake, we'll do kind of a very brief one, but we actually have a lot of evidence that this can help with a variety of side effects that you experience with treatment as well. We actually see that it can help with nausea, it can help reduce vomiting, anxiety, and depression when used during treatment. We're going to practice, probably do maybe one that's about 2 or 3 minutes long, but I would like to note that we do not want you using this if you have any cardiovascular illnesses like hypertension or any history of kind of any cardiovascular events. This is also not a very good technique to use if you have a pain disorder, specifically musculoskeletal pain. If you have neuropathy, we actually have very good evidence that this helps also reduce neuropathy. But if you have any bone mets or any type of kind of not muscle pain, joint kind of related pain, we don't see that this is actually as good. So if you have one of those, don't participate, but the rest of us, we're actually going to take a nice open posture. A lot of times we want to make sure that we don't have a lot of crossing going on. We really want kind of legs uncrossed, arms uncrossed, kind of laying in kind of hands in the lap. And then you can close your eyes or you can open your eyes, but I am going to walk through a couple of the kind of tensing and releasing that you would do with progressive muscle relaxation. And so muscle tension is commonly associated with stress and anxiety, and it helps our bodies prepare for dangerous situations. Even though some of those situations may not actually be dangerous, our bodies are responding. And so what we need to do is help the brain understand that there's a difference between kind of actual danger and just feeling stressed. So get into a comfortable position, close your eyes, and just sit quietly for a few seconds. Now I want you to build up the tension in your lower arms by making a fist with your hand and pulling up on your wrists. Press your fingers against the palms of your fist. Feel that tension through your lower arms, your wrist, your fingers, knuckles, and your hands. Just focus on that tension. Notice the sensations of that pulling, of discomfort, and of tightness. Now release the tension. And let your hands and lower arms relax into the chair with your palms facing down. Focus your attention on the sensation of the warmth in your hands and your arms. Feel the release from the tension. Now, tense again and hold for 10 seconds. 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax. Again, noticing how your body feels different when tensed versus feeling relaxed. Now build up the tension in your upper arms by pulling your arms back and in towards your sides. Feel the tension in the back of your arms as it radiates up into your shoulders and your back. Focus on that sensation of tension. And we're going to hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, and release. Let them relax heavily down. Focusing on your upper arms, feel the difference compared to when you're tensing previously. See how your arms feel heavy, warm, and relaxed. And so what we would normally do with progressive muscle relaxation, we really want to move body part by body part all the way from the top of your head down to the tip of your toes. With that exercise, we kind of just did upper arm and lower arm, right? I have people who get even more specific and they'll do, just the hands, then maybe the lower arm, then the upper arm, then the chest, then the stomach, and they break it down even into smaller sections. What we really want you to be doing is focusing on that tension for about 10 seconds and then allowing your body to relax and notice that relaxation for about 10 to 20 seconds. And when we kind of advance through the slides, I'll actually show you some websites and phone apps that you can actually download to help with practicing progressive muscle relaxation. But again, any cardiovascular illnesses or pain disorders, we really want to be very mindful of not doing these exercises because this could actually cause more harm than good. Another technique that's actually very helpful with relaxation training is guided imagery. And so this actually assists with activating all your senses and also assists with reducing stress. We're not going to practice a guided imagery technique just for the sake of time. I want to make sure we end about 10 minutes early for questions. I think everyone is pretty familiar with guided imagery, right? We are either guiding ourselves through a happy place, like in a forest or on a beach. I don't know about you guys, but I have kind of difficulty doing kind of some of that, creating that image in my mind. And so I'm also going to share some apps and websites that are helpful with this because someone that is talking to you and they are helping create the image. They are telling you what they want you to focus on and what you should be seeing around you. And so if you're somebody like me who kind of lacks kind of creativity or isn't as imaginative, some of those websites and phone apps are going to be a lot more useful because they're going to help you kind of guide through that. Again, we actually do see that this can result in physiological changes within our body. We actually see after doing guided imagery, this temporarily increases the number of immune cells within our system, and it also helps reduce feelings of depression and increases well-being. When we talk about immune system, again, we think that by lowering the heart rate, reducing the blood pressure, we again are reducing that burden on the immune system and actually kind of helping that body kind of increase. We do see that they're just temporary. They don't seem to last, for days, but we do see several minutes to hours. And so this is also a good technique that would be something I would want you to do in your nest in order to start getting yourself ready for bed in that hour about before bedtime. This is also a very simple technique that I like a lot. This is actually called Foursquare breathing, and you usually start in one of the corners, one of the top corners. And what you do, or actually you start right before the inhale, is you inhale for 4 seconds, you hold that breath for 4 seconds, you exhale for 4 seconds, and then you hold for 4 seconds. And so you breathe in, 2, 3, 4, hold. Exhale, 2, 3, 4, hold. If you have lung cancer or you've had any radiation to the lungs, this might be a bit difficult for you. The holds are specifically the most difficult portions for people to complete. And so if you do find that it's difficult to hold your breath for that long, just alter it. When I have people start this technique, I usually have you start with doing about 1 or 2 second holds and then working up to a 4 second hold. We really don't need to be breathing in for longer or exhaling longer or extending those holds. If we can eventually work our way up to 4 seconds for each, that would really be as much as we're looking for. And so this is a technique that's also good if you're just stressed in general situations. We're at work, we're around family, and we're just getting kind of irritated. This is an easy technique. We don't need a phone, we don't need a website. You can just kind of go through that breathing in your head, and most of the time people don't even notice that you're doing it. And so I really like this technique. And so if you're interested in doing progressive muscle relaxation, guided imagery, or any other type of mindfulness activities, here's actually a variety of phone apps. I use Guided Mind. If anybody has seen me in individual therapy, they can attest that one of the first things I tell people to do is download the Guided Mind app. This app is actually free. I like that a lot. You don't need a username or a password or anything like that. When you open the app, you'll see a variety of topics like progressive muscle relaxation, mindfulness, guided imagery. They even have one entitled cancer. And there's lots of free content. There's going to be some locks next to some of the stuff, which means it costs like 99 cents or $1. Just scroll past those and just do the free stuff. I've had this app for over 3 years now, and I have bought one locked meditation. Everything else I've used has been the free ones. We also have Calm and Headspace and Mindfulness Coach. Just be mindful when you play around with some of these other apps. They also have their own in-app purchases, or they need your email or whatever. So just play around with a couple of them and see which one you find most helpful. There's also a variety of websites. One is Inner Health Studio that has a variety of audio clips that you can follow along with. YouTube also is just a very easy one. We just type in progressive muscle relaxation or guided imagery, and you'll get like 100 results. And then you can just play around, find the ones that you like, and then save them. If you want to actually get some downloaded onto your computer or onto your phone, the Dartmouth College actually has a very good student wellness center page where they have a variety of relaxation downloads, so then you can download and keep them on your desktop. And so that's another way that we can just kind of help you practice some of this progressive muscle relaxation and this guided imagery to help get the body relaxed, get rid of that fight or flight response, and increase the likelihood that we will fall asleep. It also you might find it beneficial. We've talked a lot about the cognitive behavioral therapy for insomnia tenets. You also might find it helpful just to meet with somebody and actually go through the CBTI training. It's nice. I really like CBTI. I have a lot of people who maybe hesitate to go see a mental health provider or a psychologist because they're like, well, I'm going to be in therapy forever. We're going to talk about my childhood experiences. We're just going to visit. It's not going to be helpful. Well, CBTI is actually a highly structured intervention. It actually requires a pretty thorough evaluation. And then what's nice is it is 6 sessions. And so in 6 weeks, you could be sleeping better. We would hope that by just doing these techniques that we've outlined here, that would be enough. But if you feel like you need to work with someone, myself and our new psychologist, she's been with us almost a year, Dr. Harry, are both certified in cognitive behavioral therapy for insomnia. If you would like to meet with one of us, you can just have your oncologist submit a referral. If you're a patient at St. Luke's, and by patient, I mean any patient, not even an oncology, if you have a cardiologist or a primary care doctor, you can also just put in a self-referral, and there's our number there. Or if you're looking for someone in the community who maybe has advanced hours, you can also go to psychologytoday.com. And look for providers who are trained. I would also like to remind people that during the COVID-19 pandemic, and likely for several months, likely throughout the rest of the year, we also are having video visits. And so myself and Dr. Harry are doing visits over phones, computers, and so it also is making it very accessible. And what we'll do is we'll do more in-depth training about some of the stuff that we talked about here. We actually utilize sleep diaries, so we identify your circadian rhythm. We start finding your ideal wake time, and we also do time in bed prescriptions. We troubleshoot problems to adherence, and obviously we offer those in individual therapy, and we also have done groups in the past. And with the COVID-19 pandemic, we are looking to perhaps do an online group, not through Zoom, but probably another platform like WebEx, so then we can actually hear from a lot of people. I really like groups because then we can get feedback from other people and kind of hear other issues people are having. However, I would like to note that there are certain, if you have any of these diagnoses, it's going to be more likely that you're going to benefit from medical intervention rather than CBTI. So obstructive sleep apnea, central sleep apnea, hypoventilation, non-REM sleep arousal disorders, REM disorders, and restless leg syndrome is probably actually going to be better that you are receiving a medication to kind of address those symptoms or a sleep medicine. So if you meet criteria for those, understand that you may actually benefit from going to the sleep disorders clinic and getting an evaluation and treatment through them. I also do want to talk about medications briefly. All medications have actually been shown to be more effective than placebos, but long-term use is actually ill-advised without reassessment. We have a lot of issues with the sleep medicines. Specifically, what I hear the most from people are either the medicines worked at first and then they stopped working because they have a poop out effect, which means that they lose effectiveness over time. Or they now have a hangover effect where they're working so good that the next day you almost feel hungover and drowsy throughout the day. We also have a variety of risk side effects and dependence, and we can actually complicate any pre-existing medical illnesses if you have alcohol, any renal issues, pulmonary issues, or even sleep apnea. Some benzos or some medicines that you might get prescribed if you were to ask for medicine from your primary care doctor. Benzos, Ativan or Xanax, those are actually have a pretty robust influence in helping you fall asleep. Some evidence for helping stay asleep, and they're also good if you have co-occurring anxiety. However, they're linked with cognitive impairments. Specifically, they're linked with dementia. We're seeing that people who use benzos kind of through middle adulthood or even younger adulthood are developing dementia or other cognitive impairments. Motor impairment, they're also a potential to be abused, and they are not meant for long-term use. Other non-benzos that you might have seen on the TV, Ambien, Lunesta, we again see that those help with sleep onset, but they are also very likely to have that hangover effect where we just feel drowsy or kind of out of it the next day. More likely to have cognitive issues, dizziness, dry mouth, unpleasant taste. Other medicines that we've seen people use are antidepressants, so trazodone, mirtazapine, amitriptyline. Those are actually not bad medicines if you also have a co-occurring depression. And so if you have someone who's struggled with depression for a long time, one of these medicines actually might not be a bad choice, because then we're helping sleep and we're also reducing depression symptoms. There's some evidence that certain antipsychotics also can help with sleep. Melatonin is something that I kind of hear hit or miss from at least the people who I talk to. I would say about half the people I talk to say, I tried melatonin and it worked for me. And then the other half say, I don't know what it's supposed to do, but I took it and nothing happened. We do have some evidence that it does improve the sleep quality of individuals who are in post-treatment. There's also some evidence that gabapentin can help. So if you have any neuropathy, gabapentin might not be a bad choice, because then we can address the neuropathy and the sleep disturbances. We're also seeing some evidence with cannabis, but I would really like to see more research on that. Now that it's legalized in several states, hopefully we'll have that in the next coming years. But we also see that cannabis, marijuana can also increase agitation. And so we see at low doses, it can actually help agitation, sleep, and appetite. But then we cross a threshold where it actually makes people more anxious and more agitated. And so I would like to see more research before we start using cannabis and CBD oil and things like that, so we actually know who it's appropriate for. And there's references if anybody wants to look into those articles a little bit more. And I guess now we will open it up for questions.